Hey guys, what's up? My name is Sophia and I'm in my final semester of nursing school, and in your final semester, that's when you do practicum. So I have my first shift tomorrow for practicum. Well, actually today, guys, it is 2:58 a.m. And you may be wondering like why I'm awake, why am I not sleeping, getting rest for practicum? The reason why is because I chose to have my practicum shifts overnight. So I need to stay awake. But anyways, I want to talk to you guys about the preparation of practicum because I really had no idea it was going to be like this. I did make previous videos about practicum, like choosing my unit and everything, but just to like give you guys a little brief summary of it. So we get a form, it's a practicum preference form, and we get to choose what we prefer, what units we prefer, what hospital, and like the shifts and all that stuff. So then after they get that, the clinical instructor or the coordinator will look at everything, and then she will see what hospitals will allow us to go and precept there. So then I guess like a couple weeks after, she gives us a call, and she calls based on her GPA, and then she will let us know, and she gives us updates on what units are still available. And on my previous videos I did talk about some of the units that were there, but I chose MS-ICU, which is multi-system ICU, and I'm very excited for that. So I want to give you guys a little bit of the rundown and everything. So after that, now I'm in my final semester, and that started last week. We had our orientation for practicum, and I guess keep in mind, so first semester, it was very stressful. Second, I was like, all right, third semester, like no stress basically. And now fourth semester, I kind of thought it was going to just like dwindle down with no stress, but there's definitely a lot going on fourth semester. And it's also a condensed semester. This semester is from May 16th to August 6th, and then I graduate with my BSN in nursing, which is super exciting. And I guess a little backstory, I am in an accelerated program, so everything is condensed. So with my practicum orientation, she kind of just went over like what to expect, kind of forms that we need, the hours and all that stuff. So we have forms that we need to give to our preceptor. Okay, so I got an email from my clinical coordinator on what my preceptor's name is, and that was it. Okay, so since I'm this adult now, I had to call the unit where she works and ask for her. Thing is, I don't know when she works. I just know nothing. Okay, so I had to be this strong, independent lady and take initiative and call the unit. To be honest, I was kind of like, I don't know why I was scared, but I was scared. I don't know why. Maybe I was nervous. I had no idea. But called the unit first time, asked for her. She wasn't there. So then the next day I called again, and she was there, and we spoke for like 3 minutes. She was working. Obviously, she's working in the ICU, so she's gonna be really busy. So I called her, and she did not even know that she had a preceptee. And I was like, what? Like, I thought that preceptors sign up for this because it is a big responsibility. I'm kind of working under her license. Obviously, I'm not allowed to do a lot of things. I can't administer medications without her there. But it is a big responsibility, and obviously, like, hopefully she like can teach me. That's what a preceptor is supposed to do. So I was kind of a little taken back about that she did not know, because I was like, do you know what you're getting yourself into? Because I don't, But she told me that. I'm like I didn't know what to say to that basically. So then she gave me her email and her phone number, and I emailed her and everything, and just sent her some forms. But I'm just very confused. Like, if she knew, has she ever precepted before? I'm very confused in all. I have my retainer in, so if I'm talking crazy, that's why. But anyways, we've been back and forth communication, not really a lot, but I guess I know everything that I needed is what I got. So her forms are done. So that is something that is different, because with our other clinicals, we that was kind of already assigned to us, and it was already set, so Thursday and Friday from this time to this time you have to go here, and that's it, and that's what we do every like Thursday and Friday basically. But for this, it's very different. So I had to ask her, well, this is the stuff if you are curious on what I had to give her. So I had to give her a letter from the dean that she signed, and then I had to send her my personal objectives. I'll read that to you guys. I think it's really interesting, but if you don't care, I guess skip, but don't. You'll care, okay guys? I had to give her a practicum agreement form, an overview form, and then yeah, education certificate, and my resume. So the big thing, which was, it's kind of very difficult, is scheduling. Okay, so my practicum, it is 180 hours. Okay, some of those hours are not going to go to my practicum shifts. They're going to go to like simulation and I guess like other educational things that we have to do. But for my practicum schedule, I have to see when she works, and then based on when she works in my schedule, that's when we make a schedule basically. So it is going to be roughly around 168 hours, and it's 14 shifts. So starting like now to July 29th, I have to do 14 shifts. Okay, keep in mind, like, a preceptor can just decide, like what if they call off, what if they decide to go on vacation, what if something happens and they can't go to work. Okay, so regardless, I need to have 168 hours before I graduate basically. So there's a lot of like, it's not a set schedule, because we are relying basically on our preceptor when she's going to be working. She sent me her schedule, so I looked at her schedule, I looked at my schedule, and then I made dates on when I can be there. So fingers crossed, and hopefully she's able to make it, and yeah, we don't have any issues. But life happens, so it's 14 shifts, and it is it's a 12-hour shift. So I start 18:45. So in nursing, we do military time. I don't even know that. I still don't really know about military time, but you just subtract 12 or you add 12. So 18:45, so 18 minus 12, 6. So from 6:45 to 7:15 a.m., I have to be there. And then I gave her the schedule and everything, so that was good. And then, because I'm working overnight, majority of the people are not working overnight, but I am. With our 4th semester, like I said, it is condensed. We have a lot of things we have to do. You know, we have exams, we have class, we have, what's it called? What do we have? We have our public health clinical. Public health is community, so we are going out in the community and helping and serving and just helping whatever needs that they need. So those are events that we have to go to. So we have to make sure that we have everything lined up, so then we're basically revolving all our time around practicum. So let's just say for class, I have class Tuesday from 8 a.m. to 5 p.m. So I can't work Monday and I can't work Tuesday. So that's out. When I have an event, so I have an event, let's see, I have an event for the Special Olympics, which I'm actually really excited to do, but that is, don't know where it's at. I don't know why I can't find it. I know it's in June somewhere. What the heck? Where is this? I can't even give you guys a fake date because now I'm really curious. Olympics. Oh my God, is it not even in here? Oh, okay. It is June 8th. So I can't work that day, you know? And I have to see what time that is because maybe I can't work the day before. So, you know, it's just a lot, you know? I have to take my exams into consideration and just any events or presentations that I have to do. So that was very difficult just to get everything situated. So what I did was she sent me her schedule for like, I guess like the next 4 weeks. So I kind of added as much as I can now. So then I only have 2 weeks left when she gives me the schedule, because I don't want to happen is basically I kind of space everything out and then I have 2 weeks left and there was already issues. Maybe she didn't go one day. Maybe she didn't go to work one day. So the schedule that I sent her is always subject to change depending on what's going on, but I'd rather knock them out like as soon as possible so I don't have to stress and worry just in case something happens and I don't make my hours, because if I don't make my hours, I can't graduate. So we do not want that. But I want to give you guys my objectives. I'm very excited for clinical, to be honest. I have no idea what to expect. I never met my preceptor, so I really hope we are good together. I don't know, I was gonna say vibe, but I guess I'm gonna start talking professionally, but I hope we vibe, honestly. Hope I learn from her. Hopefully I'm able to help her, and I hope, I do want to work with critical patients. I don't know if I'm able to work that right after I graduate, just because of experience and education that I don't have right now, but it will definitely, I'll definitely be able to see, I'm like, okay, this is something that I want to do, because I've only been in the ICU 2 times. One time was a personal experience that I faced with my dad, and then another one was when I observed when I was at my neuroclinical. I went to the neuro ICU for 1 day for my observation day. So those only 2 times I really experienced ICU, but this is going to be totally different because I'm going to be there for 14 shifts, and yeah, I'm definitely going to see if like, okay, this is something that I want to do. But yeah, I have high hopes though, and I am very excited. Only thing is that it is critical care, and we haven't really been taught critical care material, so hopefully like I'm able to understand some things. But I am taking critical care right now, so it's definitely helping me. And also I definitely have taken time on YouTube to look at just videos and stuff that people in the ICU should know. But I do want to show you guys my my objectives. So yeah, let me see. Okay, we had to write personal objectives and send it to my preceptor, but these are my objectives for my ICU. So administer and educate patients on medications and anticipate changes, develop an understanding of vasopressors and sedation. Yeah, I really want to get educated on like titration, because in the ICU, we have more autonomy there, or they have more autonomy there. So they'll give us a protocol on a medication, and we titrate that based on the protocol, compared to maybe like med-surg or a different unit that does not have critical patients. You will get an order to change or titrate the medication. So this is more of like you. That's why it is so important, and ICU nurses only take like 1 or 2 patients because of a reason like this, where you need to be on them. But I learned that titration can happen like every 5 minutes. That's why there's really only 2 patients. But I want to learn more about that, obviously. Another one is increase my organization and time management skills in providing care to patients. Learn how to record pertinent information on a report sheet to help organize my shift. I don't even make sense. But basically, when we have the report sheet, I want to know just how to organize everything. I don't know. On my other clinical, I was just always confused. I'm like, how do I know what to write down? Like, I don't know, but I want to get better at that. So another one is demonstrate confidence and professionalism when interacting with patients, families, and interdisciplinary teams. That will come with time, but I definitely want to practice confidence in myself, because it's something that I kind of lack. Actively participate in patients' plan of care and be part of difficult discussions. Definitely, you know, in the ICU, these patients are very, very sick, and sadly, people are going to pass away. So it is very important to, I guess, adapt to the family members and I guess approach them differently, because like as nurses, we may see this all the time and we may get accustomed to people passing away. It's just like another day, another shift, but we always have to remember that this is not new. This is not like normal for patients. So learning how to speak to patients during difficult situations is important. And what made me really want to even pursue a career in nursing, and especially hopefully in the ICU, is because I've experienced that, and I was on the other side of a family member and literally begging for the nurses and everyone to like care for my dad. And yeah, so I guess being on the other side, I think it will help me, because I definitely understand, like I understand, and it sucks to be honest, but I'm on the other side now, and being on that side, I just has given me the drive to want to be a really good nurse. And yeah, and I'm just really, really happy that I have my practicum in the ICU. So I want to interpret lab values, blood gases, and vital signs, if someone's blood pressure is going down, why, so yeah. Understand arterial lines, titration of medications, basic ventilator settings, fluid management, infusion pumps, and chest tubes. So a lot, understand common medical diagnoses and able to utilize the nursing process when managing patients. And then I just put some common diagnoses that I want to learn more about. So ARDS, sepsis, GI bleeds, and DKA. ARDS is, I forgot what it stands for, but it's something with your respiratory system and the patients are like very, very sick. ARDS. What is that? It's like inflammation of the lungs or something. Let's do a little thing, because I should probably know this. Acute respiratory distress syndrome is a serious lung condition that causes low blood oxygen. Yeah, but yeah. So I just know those patients are very, very sick, and it has to do with the respiratory system. And then diabetic ketoacidosis, that is, when your blood sugar levels are very, very high. So normal blood sugar is like 60 to 100, and I've learned that their levels can be up to like 600. Yeah, so increase competence in the ICU by critically thinking and being able to recognize unexpected findings and come up with a plan of action. So in the ICU, even though I've never really been there before, but what I've learned is like, everything is kind of like slow, but it could be an instant where something like traumatic or crazy happened and you have to be able to work fast. So I want to be able to learn more how to critically think and I guess observe how the nurses are. And then participate in a code and perform chest compressions on a patient. That'll be very, very, I don't feel like it's hard to do your first one, but I need to. So I really want to do that. I feel like I'd be a little bit, I guess, like iffy at first, just because like I've never experienced it before. So I don't want to like make a mistake at all, especially when this patient is literally coding, but I need to do it. And hopefully I'm able to do it. Hopefully no one codes. But if it were to happen, I hope that, I will take initiative and, not even do compressions, but take initiative and help as much as I can. And then I just put, my overall goal for practicum is to develop my confidence, continue learning, and practice my hands-on skills. I hope I can contribute to the unit and provide quality care to patients. So those are my objectives. I have everything ready. Like I said, with the scheduling, who knows how it's going to go, but I guess we take everything day by day. So with practicum, and even with my final semester, we definitely have more autonomy with just like everything is more individualized. Everyone is on their own like journey now. We used to be in groups, especially in clinicals. We had one instructor. Yeah, and we had like our clinical group. So, if we were like, we're scared or wanted someone to come to the unit with us or just wanted someone to talk to, we don't have that. We got to talk to the patients. But yeah, I'm the only student going to be on the unit. So this is really just me, which is good. We need to step out there, especially we're going to be nurses very, very soon. Oh yeah. So we do have an instructor, and our instructor is in charge of us, but it's more like an instructor than our preceptors and then the students. So I am in a group with my instructor, but, the students in that group, we're all in the ICU setting. Some are in peds, but our instructor, she is the top. So when we go into the shift, we have to text her. We do have simulation. That is basically when you are in a simulation room and there's a fake nurse. It's basically like, it's all role playing. Someone will give us report on a fake patient, and then we go into the room and we do our assessments. We there's like a monitor there, so there'll be like blood pressure and all that stuff going on. But there'll be orders, so it's basically the same thing, but it is like faking it basically. And then after, we do a little debrief of everything, and I love post-conference and debriefing, just because we learn so much when we do it. I'm not really a fan of simulation because you have to like, I don't know, you're like, hey mannequin, like how are you doing, like, you know what I'm saying? It's just weird, like you're totally faking it, but I guess have that spirit of faking it. But yeah, and when you're in there's people watching you, so that's another thing that's kind of weird, but it is very, very helpful debriefing. But we have to do that, and then we have post-conference. So that's different, because usually in clinical, after a day we have post-conference with our clinical group, but because it is practicum and it's just different, our instructor scheduled days where we have post-conference, and so we have all our people in our group. So from everyone who's in different units, I guess we're going to talk about what we learned and all that. I have no idea, but that's different with post-conference. How long is that actually? I'm kind of curious. Oh, it's only an hour? True. maybe like everyone will just go by and like say what they've learned and stuff, but who knows. Yeah, that's basically practicum. Hopefully it helped you guys in some way. I guess to take out of it is that you're by yourself now. You got to be independent. We don't have someone telling us when we have to go. I literally had to call the unit to find my preceptor. So this is more of us taking initiative. But I have to be there from 6:45, so tomorrow I have to leave very, very early because 6:40 is 5 o'clock. I live an hour away from the hospital, and I also have to take into consideration traffic and parking and then finding the unit. So I'm going to leave very, very early just because I do not want to be late. That is horrible, horrible. But yeah, practicum is something that I feel like all, like in the first semester, people talk about that. It's very exciting just because like you're in your final semester, you're hopefully in the unit that you want to be in, you're able to do more things. It's just you and a preceptor, you know. In clinicals, we could probably administer medication one time, but this time it's probably going to be all the time, and it's just you one-on-one 12-hour shifts with someone who focuses all their time on you and obviously the patients that they have. But yeah, I want to show you guys what I'm bringing to practicum, because I need to obviously have that ready. I want to have that ready, I guess now, so I can be ready. I do need to sleep. I need to see when I'm going to be sleeping and all that. It's 3:21 right now. But all right, so I'm bringing my JanSport bag. I have my little purse here. All right, I guess let me have everything ready and then I'll tell you what I'm bringing. Okay guys, I changed my position, but like I said, I want to tell you what I'm bringing. So I have my keys because essential, and also less is more when you are packing for clinical. Just remember, whatever you don't have on you is going to be in a room. Sometimes you don't know who's in that room, and yeah, I think you put two and two together. But here's my wallet. I have extra contacts just because sometimes my eyes are dry or something's bothering me. My contact just like pops out of my eye, so always extra. And then I am bringing my glasses case as well, just because sometimes like I'm so tired, and when I'm really tired, my eyes are dry, and there's just no way that I can put contacts on when my eyes are dry. So that is for sure. And then chapstick, because I'm not trying to have any crusty lips. Okay guys, look at my lunchbox. It's cute, okay? I've always like, I was too cool for lunchbox, I guess. In high school I was too cool for lunchbox, you know, always the Publix plastic bags. But yeah, I just think it's really, really cute. It was in my mom's closet, and I was like, can I have this? So I guess a little tip: bring a lot of food, because you're gonna be there for 12 hours. You're gonna get hungry, okay? So then you have lunch, probably for like 30 minutes, but then after clinical, you're starving. I remember last semester, I had my lunch, you know, and then after, I was like, I literally could eat like my steering wheel because I was so hungry. And yeah, never again. So I always bring food for lunch, and I always bring food on the way home, especially because it's a 12-hour shift and I have an hour to go home. Like no, I had to stop and I had to eat. Yeah, so I bring a lot of food. And plus, like when you're like walking to your car, I think there's like more motivation because you have food in your car to eat, or you can leave in your lunchbox. So, and also always bring water. And I'm also going to bring an energy drink, just because if I'm like dead tired, like I need something to wake me up. So I need to buy an energy drink before my shift tomorrow. I'm going to bring a folder. It's basically all the forms that are required. She already has them, my preceptor already has them, but just in case, it wouldn't hurt to have it, just in case of anything. I have a form in here that for some reason, if I go to practicum, my preceptor's not there. Hopefully she'll text me before, but I have another form that, let's just say she's not there, I can have this form signed so another person could keep me under their wing for that day. And then I have a time log. Basically my preceptor will sign it after, like when I'm about to leave the shift, just to say when I got there, when it ended, just so everyone knows that I completed my hours. So I have that is going to go in here. And then I have, this is kind of where I have everything, and basically everything here is going to go in my pockets. With my my scrubs, I have like 4 or 5 pockets, and it's so easy to especially with pens, like where are my pens? I'm like, what pocket is it in? But I don't know why I said that. Basically everything is in here that I need. So when I put my bag down somewhere, anything that's really in there is my, I don't even carry my wallet with me. That's a fake Louis Vuitton, so if someone wants to take that, take it, but please don't. I have my keys in there, and then my folder, and then obviously my lunch. And please don't take my lunch, you know. And obviously water, because we need water to stay hydrated. So stethoscope, because you already know we can listen to the heart and the lungs and the bowel sounds, or the bowel sounds, yeah, bowel sounds. But yeah. We have to bring what is it called, pen light. I brought 2 just in case something happens to the other one. And especially with in the ICU, a lot of the patients are sedated, so a lot of times you can't really assess them just by speaking to them, and pupils tell you a lot. So what you're supposed to do, a healthy person is you shine a light in their eye, in their pupil, and their pupil is supposed to constrict, and then you do it again, and then the opposite side should constrict too. But you can definitely tell a lot with your pupils, and it's just very, I don't know, it's useful to have a pen light. A watch. It has to be the hand watch. It can't be like an Apple Watch. I never use this, to be honest. Yeah, I never use it, but I wear it because we have to. Tape. Glasses, especially when, I don't know, let's just say you're doing like trach care, you just don't want anything popping in your eye, so protection. And it has the sides so to really protect you. Not glasses. Guys, it's time for me to go to sleep. Scissors. And pens. A lot of pens. I think I should probably have even more than this. So I've always had black pens, but I think it'll be very, very helpful for me and I guess for anyone, but you will see how you do as time goes on and see what works best for you. I think color coding is the best. You can maybe like red what you need to prioritize. I just think color coding is very, very helpful. Maybe you can like put green as your medications and you'll see how everything works. I still don't know what works best for me, but yeah. So that is what I'm bringing. I'm also bringing a little notepad. This is just, let's just say I learned something new. I want to write it down. Let's just say I want to learn more about something. I'll write it down so I can, go home and look at it. But there's just anything I need. Maybe I have to notify or remember to tell my preceptor something, any phone numbers that I need, just anything that is important. And then I'm assuming they have report sheets there. So that is when I will write, let's just say about the patient, So that is that. So I'm not going to write patient-specific details on here just because I will be writing that on my report sheet. But I really don't know how how today is going to go, like at all. I really have no idea. I'm kind of left in the dark here, as anyone would be. But I'm coming into this unit with just willing to learn, and I'm very, very excited. Yeah, I am very, very excited, to be honest. And I just hope everything goes well. And yeah, guys, so I have my shift today and I also have one Saturday. And then I have a test Monday in critical care. So I need to hop on that and prioritize what I need to prioritize, which is my lecture for critical care. But I will let you know how my shift goes tomorrow and also how my shift goes Saturday. Wish me luck, guys. And hopefully you found this useful. If you did, tell me, because I know it makes me really happy when you guys tell me this is really, really helpful. But alrighty, guys, hopefully you have a great day.